It's been over 4 months since Hurricane Maria devastated Puerto Rico, and about half of Puerto Rico's more than 3 million people still do not have electricity, causing that the sickest and the most vulnerable remains dire, particularly those in more isolated parts of the island, increasing a long-time healthcare crisis.
Puerto Rico has been in basically a state of emergency since before Maria. So they have, high unemployment rate. I think it's up to 60% of the population of Puerto Rico does not have access to health care, and it has actually gotten worse since the hurricane.
If the U.S. government, for one, I think we have to encourage, pressure the U.S. government to respond to what is essentially a colony, but a possession of the United States, to respond in an appropriate manner, not just by the president throwing paper towels.
Since then, nurses from New York State Nurses Association, known as NYSNA, have been answering the call for help by volunteering their services throughout the island. In January, NYSNA organized the third medical mission to provide medical aid.
And what we came to do here was to provide a free health clinic. Our team is organized around a doctor who's a provider, and we're the support system. We're the nurses that are helping him to screen and see the patients.
The nurses quickly unloaded their equipment, gear, and medication that they brought from New York and set up the field centers to provide medical care.
We're here again, and this is wonderful. We keep getting volunteers who want to come to Puerto Rico, want to go to the Virgin Islands, and we're back again. And every time we come, it's like people being born again and finding nursing and finding medicine the way they wanted to practice it.
Es importante llegar a estas comunidades porque aunque nosotros podemos tener hospitales cercas y podamos tener hospitales o algunos servicios médicos, aquí si tú no tienes un plan médico no te atienden.
Many of them share stories of devastation, lack of resources, and looming mass health crisis. Some of the nurses have reported providing care in isolated and impoverished areas of the island that have never received federal aid, which has increased the number of hopeless survivors that decided to commit suicide.
It's something that happens when people feel that they are just at their wits' ends and they could no longer take care of themselves. They may have some pre-morbidity to a psychiatric diagnosis. I'm a psychiatric behavioral health nurse, and I believe that when things like disasters happen and tragedies, that yes, that the if you don't have your resources and availability to handle that already, then yes, you're going to have a worse problem.
After Hurricane Maria, the rate of suicide increased to nearly 1 a day in Puerto Rico, according to a recent report by the Commission for the Prevention of Suicide. The report also found that 85% are committed by men and 14% by women. Many health specialists and doctors said the spike in suicides can be linked to the aftermath of the storm and the destruction of basic resources like food, water, electricity, and housing. Those nurses from NYSNA not only provide medical assistance, but they are also helping them mentally to get ready for the next hurricane season, which begins in June. Reporting from Puerto Rico, Ronnie Carvello.